part of racing on a bike is suffering. One of the first races that I did in Spain, I'm descending, and I crashed at probably 40 miles an hour. Before I'd even gotten up, there was a mechanic with another bike, and there was no question you're going to get back on the bike and go. And you apply that logic to, sort of everything else. My name is Duffy. I was diagnosed with heart failure at 23. I had a heart transplant at 29, and I've been a patient of Dr. Baggish at the Mass General Cardiovascular Performance Program since 2015.
The Cardiovascular Performance Program is designed to take care of athletes and highly active individuals with either heart disease or risk for heart disease.
So the Cardiovascular Performance Program at Mass General is the first of its kind. We're made up of a team of clinicians who, as athletes ourselves, understand the active lifestyle of our patients.
I was living in Alcoy, Spain, and got this weird gastro bug. Didn't really know what it was, and like an idiot, I was like, well, I'm going to try to fight through this, and probably got on my bike too quickly. I started training again and just never really felt good. I didn't feel horrible. I didn't feel like I was going to pass out or sort of die, but I never felt good. So I go to get the cardiac ultrasound done, and he reads the results and he says, we should double check this. Long story short, he's just kind of shocked, and he's, you shouldn't be able to walk down the street. And I was like, well, it's impossible that I'm in heart failure because I rode my bike 50 miles this morning.
Chris's story as an athlete and a patient is incredible. He really highlights our collaboration with our sister institutions. He received both his heart failure and transplant care at the Brigham, and the cardiologists there recognized his identity as an athlete and the importance to preserve that. And they referred him here to the Cardiovascular Performance Program at Mass General.
Chris, as most athletes would do, got back on the bike within days of having his transplant. And this should come as no surprise, but part of Chris's recovery, part of his recovery of his identity, was to figure out how to maintain his place in the world of cycling.
No matter how good of a cardiologist they are, no matter how good of a doctor they are, doctors, you often get the sense, don't understand what, you tell a doctor you go for a bike ride, and they say, oh great, you go ride your bike 10 miles. You're like, yeah. And then another 70.
Recovery from any form of heart disease is a process. It doesn't happen overnight, and what we do is work with patients to figure out the rate with which recovery should occur, and we give them milestones and benchmarks that we as doctors, but also they as athletes, can use to gauge their recovery.
I'd actually heard of Dr. Baggish from a number of people. It was great. I mean, here was a guy that kind of not only sort of could treat me in terms of he's a cardiologist, but he's an athlete.
Chris, in many ways, represents a situation that we get into with many of our patients where we work with them to develop a care paradigm that fits their goals, their objectives, and also what we know medically about them.
He kind of understood off the bat me. It was really important to me and my wife that if I was going to start cross-country ski racing at first, and then mountain bike racing, and then maybe even road racing again, that I do it in a way that was smart.
And our partnership has really been about helping him do that in a way that complements the superb care he gets from the heart failure transplantation doctors, but enabling him to be the cyclist he wants to do while simultaneously not jeopardizing the safety of his transplant. Working
with Dr. Baggish really it's something that I would believe anyway, but it validated it. Having conversations with him made me feel like I wasn't crazy, like that I'm not crazy for doing these things, that it's, so long as it's, again, done in an intelligent way, that there's no reason I shouldn't sort of be healthy again and to sort of live life normally. It allows you to do that without sort of concern or fear. You've got someone in your corner.